From Galileo to today, how the separation of church and state shapes women's health. In 1616, Galileo was warned by the Roman Catholic Church to stop exploring the concept of heliocentrism, a theory that places the sun at the center of the universe, with all planets revolving around it. Geocentrism was a fundamental theological truth at the time, and Galileo's opposition undermined their authority and interpretation of Scripture, leading to Galileo being condemned in 1633, and his works being banned. It wasn't until 1822 that heliocentrism became widely accepted, and not until 2000 that the Catholic Church admitted wrongdoing. This historical clash highlights how religious beliefs can obstruct scientific progress, a tension that persists today in healthcare where the stakes are often life and death. The idea of separating church and state was first introduced by Puritan minister Roger Williams in 1644. His goal was to protect individual conscience and religious freedom from government interference. Thomas Jefferson later expanded on this concept, advocating for a wall of separation in his 1802 letter to the Danbury Baptists. These principles were enshrined in the First Amendment through the Establishment and Free Exercise Clauses. When applied to healthcare, this separation ensures that medical policies are guided by evidence and patient needs, not religious ideologies. This is vital for protecting individual autonomy, advancing public health, and ensuring equitable access to care. Religious influence in healthcare policies profoundly impacts women's health, particularly in reproductive rights. After the overturning of Roe v. Wade in 2022, 13 states enacted near-total abortion bans rooted in moral and religious ideologies. These include states like Alabama, Arkansas, and Oklahoma, which have made abortions illegal except in cases of severe health risks to the mother. This has left millions of women without access to abortion care, forcing some to carry non-viable pregnancies to term or travel out of state, a burden particularly felt by marginalized communities who face additional financial and logistical barriers. But abortion isn't the only issue. In some states, religious employers can deny insurance coverage for contraception, citing moral objections, a precedent set by the Supreme Court in Burwell v. Hobby Lobby, 2014. For example, under these laws, companies can deny access to birth control, like IUDs or contraceptive pills, leaving women with fewer options to manage their reproductive health. This disproportionately impacts women in low-income or rural areas who rely on employer-sponsored insurance for health care. Religious opposition to the HPV vaccine has hindered vaccination efforts globally and in the U.S., particularly in communities where religious leaders influence health policy. Some argue that the vaccine encourages premarital sex, resulting in lower vaccination rates in certain areas. This resistance has led to preventable cases of cervical cancer. When religious beliefs shape healthcare policies, marginalized groups, particularly women, bear the burden. Policies driven by ideology rather than science lead to preventable deaths, inequities in care, and unnecessary suffering. The separation of church and state in healthcare isn't just a legal principle. It's a safeguard for fairness, freedom, and science. By upholding this separation, we can ensure that healthcare policies prioritize evidence and patient welfare, giving everyone the opportunity to make informed decisions about their own bodies and lives.